National COVID Antibody Study has been stopped after data collectors were attacked. The study began assessing the prevalence and impact of COVID-19 last year. For more on this, we're joined by the CEO of the health research company Epicentre, Cherie Cawood. Cherie, thank you so much for your time on eNCA this evening. What's the name, the actual aim of this National COVID Antibody Study?
There are really two aims of the study. Firstly is to find out exactly how many people have already been infected with COVID, so we can see how the epidemic has spread throughout the country. And secondly, it's really to understand why some people get the COVID really badly and some people have no symptoms at all. And in my experience, from running a lot of COVID tests, about one person out of every three will get COVID badly or sort of have symptoms, and two will not even know that they've had COVID at all. So we really need to understand this very new disease and understand what's driving the bad infections.
So what issues have your researchers been confronted with in carrying out the study?
What has been happening to my field workers, and we've got about 200 field workers in the field because we're running two national studies. One is called halted, and the other one is called eNCA. And they're running in different areas in South Africa, but they're both household studies, which means we have to go to sampled households of people that have been chosen to be representative of the people in South Africa, and then we go and do a survey with them and ask them to give us a sample of blood. And we're finding that people don't understand why we're asking for blood, because they think that we should be asking them for a PCR to test. And they're very suspicious. And then what has now happened is they have started taking pictures of us, and it happens every single day, is their pictures are taken of our field workers and then they are posted on social media with negative connotations. And our field workers have been attacked, they have been traumatized, and the response rate of the survey has been really poor. And we really need the science for us to be able to beat this epidemic. So we need the people of South Africa to recognize that we are doing good, that we're putting ourselves on the line to help the people of South Africa, and for them rather to take pictures of us with their families participating in the survey and doing something to end this epidemic and posting those pictures on social media. Because it's not helping them and it's not helping us if this just keeps on going on.
So you've now decided to pull out your team out of those communities. How do you plan on continuing with the study? And have you considered maybe having a conversation with some of the community leaders, if you haven't already? Because I suppose that normally helps to speak to leaders who then are connected to the communities and can explain the kind of work that you're doing.
So maybe saying that we've pulled out is not completely correct. We've pulled out of a number of different areas where it has been too dangerous for our teams to operate. And our modus operandi is always to go and meet with the councillors, meet with the local South African police, and where they've said that the negative connotations of the fear and suspicion and lack of understanding of our study is too great, those are the areas that we're not working in. We are still working in other areas where the councillors are helping us, sending people with us to those communities. So what we really would like is for South Africa to embrace the study and to help us implement the study, because it's very much like what we did with HIV 20 years ago. 20 years ago, we knew nothing about HIV. It was killing our people. And COVID may not be killing as many people, but it's decimating our economy, and that's going to kill us all. So we really need South Africa to embrace science like they did with HIV, because we're really using the same methodology to understand this epidemic and to help us help them.
Cherie Cawood, thank you so much for your time.